Hi, I'm Dr. Naveen Thomas. Now I'd like to address part 2 of the frequently asked questions about KAP. Well, the most common side effect of ketamine is a decreased awareness of the sensation in one's body. And this is completely normal and absolutely nothing to worry about. Some people may even feel numbness throughout their body. With the orally dissolving tablets, there may be a sensation of numbness or tingling in the lips or in the membranes of the mouth. Once again, this is also completely normal and nothing to worry about. Some people will experience nausea, either during the actual KAP session or perhaps even afterwards. If this nausea is intense enough, we will have the option of administering an anti-nausea medication. Ketamine will likely temporarily and modestly increase your blood pressure. This is usually not a problem unless somebody has an underlying history of very high blood pressure, which is not well controlled. Some people will experience a headache either during the session or afterwards. Typically, whatever type of over-the-counter treatments that are useful for managing the headache can be used effectively. Some people will experience some dizziness, once again, either during the session or immediately afterwards. This will typically be managed with simple recommendations such as increasing the level of fluids and going from a sitting to a standing position more gently than normal. If a client has uncontrolled hypertension, we will not be administering KAP until that blood pressure is maintained within a safe level. Next, there are certain cardiac rhythm disorders that will not allow us to use ketamine safely. If someone has a history of very high pressure levels in their cerebrospinal fluid, in their spinal cord and brain, we also will not be able to administer this. If someone has heart failure, it is not safe to use ketamine. If someone has a recent stroke or a tumor in the brain, it may not be safe to use ketamine. We will ask that you fast from food for approximately 4 hours prior to your session. This is primarily to decrease the chances of nausea that may arise. You are allowed to drink water. We do ask that you keep it modest. We would like you to limit alcohol the day prior to your session and avoid alcohol the use on the day of the session. But we'd also like to ask that you minimize the use of any stimulants on the day of your session, including caffeine. You can use it at modest doses, perhaps 1 cup of coffee. Also, we ask that you please arrange transportation to and from the KAP session, preferably from a trusted person, such as a spouse, a family member, or a friend. It will not be permissible to drive yourself to and from the session. It's just not safe.